Good morning and welcome to the June Health Innovation Community Partnership meeting. We are going to go ahead and get started. As we know, June is Pride Month, so we're very excited to step into June, step into Pride, and we'll be sharing a little bit more about some of the activities here at Los Angeles General related to Pride Month. Next slide. In addition, the month of June, we celebrate Juneteenth Freedom Day, which was also a county holiday. Next slide, please. Next slide, please. And next slide again. So, as you know, we record our meetings. We're really excited to share space with you all in person and via Zoom with our hybrid audience, or it's not our hybrid audience, our audience, a remote audience that we share space with in the Zoom room. We will be recording today's meeting and posting it on our website in about a week's time. We do want this to be a highly interactive session. As always, this is time to ask your questions, bring forward your comments. We really want to hear from our audience, both in person and via Zoom. Next slide. Taking a quick look at our agenda for the day, we're going to do our meeting overview and guiding principles, which I'll read in just one moment. Then we have an update from Los Angeles General Medical Center. We have two of our wonderful providers here today to speak with us about happenings on the campus. And then we're going to hear an update from the Wellness Center on a project called the Community Public Health Teams. And then we're going to go into a good deep dive into updates on our campus projects. There's a lot going on the campus this month of June, and we're so excited to share it with you. And then we'll end presumably a little bit early today with partner announcements. So please, everyone who has an announcement they'd like to make to this body, please be prepared to share with us at the end of the meeting. Next slide. To begin, we'll read the HICP guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent so we can share how we reach our conclusions so that others can understand divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, we'll move on to our next slide. And I invite Dr. Karla Gonzalez and Dr. Tracy my apologies. Smacko? Samko. Okay, there we go. That makes a lot more sense. And Dr. Tracy Samko to come up and share an update from the Los Angeles General Medical Center. Dr. Gonzalez.
Thank you. And so it's my great honor to actually introduce Dr. Tracy Samko. Dr. Samko is going to bring us up to date with some of the wonderful events that are happening this month for our LGBTQ plus community and patients. And I just have to thank you so much for all the work that you've done. Dr. Samko has been an incredible champion, and though we know that this is an issue that should be with us and has to be with us year round, we're actually excited to take a few moments to learn about what's happening this month in particular, to be part of it and be able to be commemorative. So thank you, Dr. Samko, for being with us.
Thanks everybody so much for having me. I'm Tracy. I use she and her pronouns. I'm the associate medical director associate program director for internal medicine and pediatrics, but I also am a clinician primary care in the adolescent care and transition clinic here at the medical center. Can I advance the slides or do you? Okay, great. So we actually just celebrated our 10-year anniversary at the ACT Clinic. The ACT Clinic launched originally to support transitional age youth with complex medical and social needs. Shortly after the passage of the Affordable Care Act, we were able to offer expanded care to adolescents and young adults graduating out of foster care. So we came out of the hub clinic system when these youth previously had not had access to care. And we also have a partnership with Children's Hospital Los Angeles for youth with complex medical needs who are transitioning to adult care here at the medical center. So under that umbrella, we also founded the Alexis Project, which is our clinic for LGBTQ plus youth. Actually, we serve LGBTQ plus patients of all ages because when we were looking around the county at the time, we realized that while, certainly in the positive care spaces and individual providers were doing this care, there wasn't really a dedicated clinical space, especially for transgender and gender diverse individuals. And so we founded the Alexis Project for people of all ages, and we're the founding site for now DHS's gender health program. So we're all across the county now, not just at LA General. Really want to shout out my amazing team at ACT Clinic. Jackie Corletto, our medical caseworker, is our founding medical caseworker. She's been instrumental in growing the program and caring for youth into adulthood and grounding us all. And also our founding physicians, Dr. Eunice Rios and Dr. Astrid Hager. So we're just happy to celebrate our clinic, and thanks for being here with us at the medical center over these years. I also want to make everybody aware that this weekend is the Los Angeles Pride Parade. We'll be marching on Sunday, June 8th, with DHS, so LA Health Services, countywide. We have a contingent. If you are interested in marching with us, you can still sign up. The Workforce Weekly has a registration link. This is our 5th year of participation. We're really excited that LA General has been incredibly supportive of our participation. We are the founding March members. The reason that we're out there as a whole health system is because of the support of LA General. So we are happy to support our employees, but also to support our patients and community by showing that we're here for them. And I think that's all for me. Thank you so much for having me.
Thank you so much, Dr. Samko. It's wonderful to be able to have these opportunities to celebrate and commemorate. So thank you. So I am very, very honored to just announce and be able to express my gratitude for the emergency department and the entire hospital for celebrating our nurse, our dear nurse, Sandra Shells, that passed away, and honoring her in the form of a scholarship. And this was a wonderful collaboration with the School of Nursing. I was so excited to be here because the two recipients really, really just exemplify the type of nurse that Sandy Shells was. I actually have the opportunity to work every day alongside one of the recipients, Brandy Palacios. So if you knew Sandy Shells, one of the stories that they tell is that Sandy knew not only your birthday, but she knew your children's birthdays and would bring gifts for your kids and your family members. She didn't know them personally, but they were an extension of her family. She was very, very close to her ER family and her LA General family. So it is not a surprise that the team has picked these two very deserving recipients. And I couldn't say it better than Brandy. Brandy said it doesn't matter if it was 1 penny or $50,000. She's like, anything in the name of Sandy Shells would have been such a great honor. So I am so excited that we get to continue to honor her, continue to inspire other nurses coming forward, coming to LA General, and then also being able to commemorate these two wonderful participants who received the Sandy Shells Award. Next slide. And this next topic is really important. So I was just having a conversation earlier with my colleagues about technology and all the things that change very much every day. So now we're living in a world of AI. I mean, we're so past like texts and phones, and I'm so excited that I see everybody that has like their smartphone. There are so many ways for us to communicate and gain information. And I think that sometimes we miss out on these opportunities. I know that one of my colleagues, Melina, and I went to a conference where they told us that if you haven't started working with AI, you're already behind, right? And that makes us a little bit nervous, but also it gives us this opportunity to talk about what are those gaps in technology? What is a digital divide? What do we need help with as a community? Are our people actually getting the services that they need? Are they learning how to use their phones? Are they learning how to use the internet? Are they learning about AI? So I'm excited to tell you about an opportunity coming up Thursday, June 26th at La Mirada Library. And this is a community forum for you to talk about what it is the needs of our community are when it comes to the digital needs of our people. So please join us if you have ideas. And I know we all have them. It's just a matter of having these conversations. Like I just had one with my colleagues. We're like, wouldn't it be nice if we had something to dictate our note? And that already exists. We just aren't using it yet. So we're excited to be able to use that technology. Everybody should be excited about it, and it has to be meaningful to you. So please bring your ideas forward on June 26th. Okay. And thank you so much. Thank you so much, Heather.
Thank you, Karla and Dr. Samko. Very exciting to hear about those wonderful opportunities coming up. And of course, just a reminder to join DHS at Pride this Sunday. Okay, is this an announcement you want me to like? Okay, there's an announcement we'd like to share with everyone. Native American Made is collaborating for a countywide fall 2025 LATTC Health Career and Resource Fair with the LATTC Nursing Program, LA City Workforce Development, and WIB Healthcare Sector Advisor Dr. Kelly Nguyen, co-founder and CEO of Dr. Kumo Inc. and drkumoacademy.org. LARC 19, LA County Community Colleges, the LA Veterans Collaborative, crcd.org, LATTC Campus Workforce Center, Unite LA, and ccalac.org. And there's 66 FQHC clinics. Please reach out if interested in having a booth represented. So we'll go ahead and make this announcements during partner announcements at the end, so I can put a slide together to share this information out with you as well. All right, so moving on to our next slide. So we're excited to share for our normal segment about community health and wellness. We're going to share a presentation from the Wellness Center. We are the very delighted recipients of an award from the Department of Public Health that we share in partnership with Clínica Romero to serve the communities of Lincoln Heights and Boyle Heights as part of the community public health teams. And to talk about this today is our program manager, Melina Castelan, who is also our care team lead and supervisor at the Wellness Center. Melina.
All right. All right. Good morning, everybody. So good morning. My name is Melina Castelan, and I'm as Heather mentioned, the program manager for Reaching for the Heights, or Alcanza las Alturas. And I'm here to talk to you all today about the Community Public Health Teams Initiative, or more specifically about what we've been piloting here in Lincoln Heights and Boyle Heights for Reaching for the Heights. Over the next few minutes, I'm going to share with you all about what we've been learning over the last year from our door-to-door outreach and the strategies that we've implemented to build trust with our surrounding neighbors and how you can become involved. First, we're going to talk a little bit about what is CPHT, or Community Public Health Teams. This is a county-wide initiative developed in partnership with the LA County Department of Public Health. A little bit over a year ago, you might have remembered if you were here about Heather and Rosa talking about this initiative and about the Wellness Center having the opportunity to partner on this. And as she mentioned, it's with the Department of Public Health, Clínica Romero, that is just across the street, and the Wellness Center coming together and offering this innovative way of offering health into our communities. And it's built on the idea that health starts in a community, not just in the clinics, and that the people closest to the challenges are also the people closest to the solutions. Our job is really to engage, to listen, and to act, especially in these historically underserved neighborhoods. It comes from a very successful model that was implemented in countries such as Costa Rica and Cuba, where they would have these multidisciplinary teams assigned to these hard reach neighborhoods, where their team would usually include something like a physician and a health worker going in and providing direct care, such as vaccines and wound care. We don't have the ability to be able to do something like that, so our model looks a little bit different. But we do have a community health worker, both from Clínica Romero, which is the FQHC, and the Wellness Center, going out and learning and conducting these household assessments and learning about the needs of these homes and connecting them to the resources based on the needs that we find from the homes. And so it's really this opportunity to learn more and to provide these direct services, right? So say it's more than just an assessment, right? It's an opportunity to learn. And say somebody says, hey, I already have health insurance. Great. So when's the last time you were able to see your provider? Well, I haven't been able to see them because it's really hard to get an appointment. Would you like me to sit with you and make that appointment, right? Have you been able to get into your specialist? When's the last time you were updated on your vaccine? So it's really an opportunity for these community health workers to be able to provide that specialty service. It sometimes is really hard to get in the clinics because we need to get people, into their care and out the door to get into the next person. So next slide, please. The program really operates on these 5 core strategies. One is to visit each household to conduct these yearly household assessments. 2 is to ensure households are connected to these healthcare and social services. To analyze the data on health, mental health, and social determinants of health. To convene community members and develop community action plans together. And then to mobilize partners to advance health equity and improve conditions. And our service area is divided between 10 census tracts in Boyle Heights and Lincoln Heights, which gives us approximately 8,000 homes in between this area. When we originally started this project, they had told us it was about 10,000 homes. But again, this is what they originally thought it was. But as we've been going and we've been learning more about the area, we've actually realized it's only 8,000 homes in the service area. So again, it tells you this is the idea, but as you go and you learn more specifically about the community. Next one. And what are some of our strategies to date? So what have we learned? So from these door-to-door household assessments to date, we've been able to visit just over 8,000 homes. And sometimes these homes, you have to visit multiple times, right? So it's either because they didn't answer the first time, or sometimes it's because it's not a one and done. You go to a home, you start helping them with something, and sometimes you have to continue to come back because they needed food and they weren't able to go to the food bank. Our community health workers are coming back with the bag of food and helping folks with that. So sometimes it's more than that. So the number of actual visits has increased in that. Completed household assessments, that means these full conversations about the needs, have been about 1,300 of those. And like I mentioned, these assessments are not just intakes, they are full conversations to help us understand what's impacting the health at a street level. We've also been able to start, and it was a rough start to be able to do this. It took many months to start our resident advocacy committee, and we have some of our resident advocacy members here. If you're part of our advocacy committee, can you raise your hand? Betty, Ada, si son parte de nuestro comité, si pueden levantar su mano. Yay! Shout out to our team. We have about 14 members who meet monthly. These are folks who live in the neighborhoods who have helped us, put on our community convenings where we have the opportunity to share back our findings. They have helped us put on the presentations that we share back at our convenings. They facilitate some of these presentations and the conversations that we get to have with our neighbors. So thank you for our team for being here today. We've also been doing presentations at different schools, churches, and community events. We've been really focused on meeting people where they are. We know that we want to invite people to the health center. We want to invite people back to the wellness center, right? And to be able to come to services. But before you can invite somebody to your house, you got to meet them where they're at and you got to build trust, right? So that's what we've been doing, and we've been working on that. And then we've also been hearing, and you'll see in the next slide, we've been hearing a lot about food insecurity. So we've been putting on these food distributions. And just this year, we've been able to give away about 5,000 pounds of fresh produce. Again, in different community centers, parks, churches, we've been able to bring out these food distributions in that area. Next slide. So what have we learned? So from these conversations, from these community meetings, we've been able to learn these top 3 things. So top 3 community concerns that we've heard is street cleanliness. People want to exercise. They want to get out there. They want to be able to go to their parks. They want to do that. But the streets, they say, I remember having this conversation with someone. They were like, I want to take my kids to the park, but I bring them to the park and we go by the swings and there's so many needles like buried by the swings, right? So I can't do that. So street cleanliness is a huge thing for our community, right? There's a lot of encampments in our community. We have a neighborhood that we visited recently where it was a closed street and it was an encampment, and they literally took over the whole end of it, where the neighbors were like, nope, we don't use that whole end of the street because we're terrified to go over there because we know that's. And they would come and they would clean out a certain part of it, but they knew that they could not touch, like even the city wouldn't touch it. So it's very interesting, the dynamics of how it happens and the neighborhoods start building on it, right? Public safety is a huge one. We're in neighborhoods where we know that gangs are a real thing, and public safety is a huge thing. People are concerned. Parents have to work, kids have to walk home from school, and parents are like, I don't know what's going to happen to my kid when they're walking home from school. And that has been something that has been brought up time and time again during our community meetings, right? And food insecurity is a huge thing. We've been, as our team is out there, we're going into the local, stores, right? They don't have, it's a food desert, right? And as we're going into these local stores, some of them do sell produce. The produce is, past their time. It's so expensive and they don't have access to other things, right? So it's either that or you have to drive. And if you don't have a car, then you got to take a bus. So that is a real thing in there. And then the top 3 health conditions that we see. So that is part of the questions that we ask. The top 3 is prediabetes, diabetes, and heart disease. And then the top 3 referrals that we do make is health insurance enrollment. Because one of the questions, so a lot of the questions that we ask, or all of the questions that we ask, it isn't about the individual person, it's about the entire household. So maybe the person that we're speaking with does have health insurance, but we're asking questions about, is it you or anybody in your household? Does everybody have health insurance, right? So as we ask these questions, it could be that somebody else doesn't, or it could be like somebody lost it. When people ended up sometimes people don't know how to fill their paperwork correctly, or they get changed into this different Medi-Cal that they don't even know where they ended up, where their medical home ended up, right? So then they go to their doctor and they're like, nope, you don't belong here anymore. And then all of a sudden they can't see their doctor. We get that a lot, right? So enrollment advocacy is a huge one. CalFresh, getting screened for it. And then tenant rights. A lot of folks being afraid of even, there's been rat infestations, things like that, but people being afraid to speak out about it because they don't want to get kicked out of their homes, right? I pay a little bit here. I know how the rents are around here. I don't want to move it. It's enough for me right now. I rather put up with this. And we hear that. And so that has been a conversation that we've been having with community too, because they still have rights that they can exercise. So these are some of the findings. Next slide. And so I'll pause there for a second because I know I just said a lot before I move in to how to get involved. Because if there's any questions. No? Okay. On how to get involved with us, we do meet monthly with our resident advocacy meetings. So our next meeting is in person. We meet in person at the Wellness Center. The next one is July 18th at 12. And then this is our QR code. This does lead into our social media handles, and then you can stay up to date with all of our events. And then our next community cleanup is scheduled in July. We will have a bigger campaign with the community cleanups coming up, so please join us to stay updated. Okay, cool. Thank you.
Thank you so much, Melina. Yeah, we're really excited about this opportunity to partner both with Clinica Romero and with the Department of Public Health and really get to know our neighbors in a brand new way. Out there in the streets every day, visiting households, talking to families, understanding their needs as a family unit and as the larger community. So we definitely invite you to join us in some of our activities in the coming months, including our community cleanups. And we'll be having that ongoing dialogue about sanitation, public safety, and health and wellness in our community. Next slide, please. And congratulations to the that's right, Melina is not just joined by our fabulous resident advocates, but also members of the public health teams that are out there in the field every day, building those bridges and really supporting our communities. So thank you one and all from the community public health teams. All right, next slide, please. Okay, so here we go. Deep dive into some fabulous updates on our campus projects. We'll start with Alicia Ramos talking with us about the Restorative Care Village phases 4 and 5. Alicia.
Good morning, folks. As Heather said, my name is Alicia Ramos. I'm with LA County Public Works, and we are managing the projects on campus, which predominantly you'll see at the corner of Mission and Zonal on the west side of the campus. So we want to take you through just an update. We'll show you some images of what it looks like, and we'll catch up on some of the local targeted worker hire numbers. Next slide, please. So for those of you who haven't seen this, we're just giving you some context about where we're talking about. So this is the west end of campus where the former Women's and Children's Hospital used to stand. That blue square is where the Phase 5 subacute psychiatric building is being constructed now. In the orange circle, I'm sorry, let me go back to the blue square. It includes both Phase 4 and Phase 5. Phase 4 is a 2-story mental health urgent care center, along with something we called the residential withdrawal management. And I'll talk a little bit more about those. In the orange circle, we're just, again, giving context that the RCV, Restorative Care Village Phase 1, that's been completed for some time now, is right across the way. So collectively, these Phase 1, Phase 4, and Phase 5 will be part of our continuum of care when it comes to mental health, behavioral health, and substance use. Next slide, please. This is just a graphic of what that shared site. So what we're looking at is only the former Women's and Children's Hospital site. The 2 new buildings are co-located there and will share grounds together. So the Phase 4, which you see in the blue, is a 2-story mental health urgent care center, which is operated by Department of Mental Health. The other component of that building is operated by Department of Public Health, and that is the residential withdrawal management. So just to speak a little bit about what those programs are, for the mental health urgent care, that is a facility that folks who are experiencing a crisis, mental health, behavioral health crisis, can go to and get immediate care. It is not intended to be an extended stay. The limit is 24 hours, less than 24 hours. And that is what the program there will support in terms of services. The residential withdrawal management is operated by public health, and that is a program that is centered on assisting and helping folks with substance withdrawal. Folks who are withdrawing from substance abuse can go there and will be assisted and managed through that phase of their recovery. The phase 5, which is in the red boundary here, is the psychiatric subacute. That facility is intended for longer stay, extended stay, mental health, behavioral health patients. That is going to be a 4-story building, and it will provide 96 beds towards that particular population. Next slide. These are images of phase 4 right now. So if you were to go to the West Campus, this is what you're going to see there. We've got the building for the most part up and framed. They are working on the interior, putting in building systems, mechanical, air conditioning, plumbing, electrical, and then we will come back to start doing the exterior finishes. But we are on track, on schedule. We expect this building to be completed by the end of this year. And then once the building's completed, then mental health as well as public health will go through a licensing process. So even though the building is done at the end of the year, it won't be open for services until they complete the licensing process. And I'll speak a little bit about that. Next slide. This is our phase 5 site. So you're going to see a lot of earthwork there. We're in the ground, we're installing foundations. This is the larger of the 2 buildings. So there's quite a bit of grading and subgrade work to do before we start to see things come out of the ground. Next slide. Okay, so to speak to the schedule, phase 4, as I said, that's the smaller of the 2 buildings, the 2-story. That will be done at the end of this year. Licensing, we expect to still take probably 6 to 8 months. So we're expecting that the building itself and services will be available in the fall of 2026. The larger building, RCV Phase 5, is scheduled to complete at the end of 2026. Likewise, it will go through a similar licensing process and be available for services in winter of 2027. Next slide, please. Okay, so I wanted to highlight a little bit about what also happens as we construct these buildings. We are also targeting a local hire worker ambitious goal here. So we want to stop in and see how we're doing with it. The local targeted worker hire, what that is whenever we do large scale projects, in a certain area, we want to make sure that not just the benefits of the program once it's done benefit the community, but while it's being constructed, that process of construction benefits the local area and community too. The way we do that is with our local worker hire. So the contractor that's out there building is obligated to meet a certain threshold of local hire. Local hire is defined as 2 things: within 5 miles of the actual project location, so that would be within 5 miles of this medical center, or if they can't fulfill that, then they can also hire folks or bring folks to the project that qualify by way of being in certain zip codes within LA County that meet a threshold relative to the poverty level. So it's called Tier 1 and Tier 2, and that's how we define local worker. Beyond that, we also have a targeted worker component to the policy. Targeted worker is the county reaching out to also assist community members in finding employment for these folks who may have some barriers. It might be that they've got a justice-involved background. It may be that they don't have a high school diploma. It may be that they just have certain conditions that in the past have been obstacles to their ability to get good full-time employment. And so the targeted worker goal by the county policy, this is the Board of Supervisors policy, is a minimum of 10%. The local worker that I spoke to earlier by county policy is a minimum of 30%. Let's go to the next slide. For these projects, we have adopted an ambitious goal of meeting 50% for local worker hire. So while the policy only requires 30, we've been doing really well in meeting our ambitious goal of 50. So on phase 4, we're just under that, 49.5%. So I'm very proud to say that The contractors we're working with, they've been great team partners. They are really taking this seriously, and they're helping us meet that goal. Targeted workers, which were required at 10, are at 25.9. We're more than double the requirement. So yet again, we're working with great partners here. Phase 5, which is the one that is predominantly in grading and foundations, so we're really just getting started. But for just getting started, our numbers look really well. We're at 41% for local hire, and for targeted workers, we're at 16%. So I will continue to come back and report how we're doing on that, but we are off to a very, very good start. Next.
Local hire. What local means and what targeted means?
Oh, yeah. So local, as I pointed out, local means that these workers on the project come within 2 categories. They're either they live within 5 miles of the project, or they live within certain zip codes in the county that meet certain thresholds for the poverty level. And that's how we define local. Targeted, again, is anybody who may have a obstacle in their employment, similar things like lacking a high school degree, justice involved. There's a number of different situations that will qualify someone as a targeted hire. Okay, next slide. All right, questions. Heather, are we taking questions or do we want to save them for the back? Okay.
Any questions for Alicia about these upcoming projects and our status, both with hiring as well as with the development itself?
If not, I'll continue to come back. Yes. It's a county-wide. So again, the first tier, what we push for first is folks living within 5 miles of the project. So the med center here is where the project is. So it's a radius. It goes out like a circle. 5 miles from the project is the first tier. So if we have construction workers that live within that 5 mile, they qualify as local worker. Now, if we can't meet that because the local area only has so many folks, keep in mind that we're talking about skilled tradespeople. So it could be welding, it could be framing, it could be concrete. And also keep in mind that within Los Angeles County, there are lots of construction projects going on. So when we partner up with a contractor to build these buildings, they're pulling from a lot of the same labor sources that we are. And if they can't meet that locally, let's say within 5 miles, there's only so many construction workers within a certain trade that are available. Some may be on other projects, or maybe we're just low in this area for that trade. Then the contractor has the option to look at second tier. Second tier means pulling labor, pulling tradespeople from any of these other county zip codes that are experiencing higher than typical poverty limits. So we consider that local hire too. So it's really trying to say we want to pull from the local community, but if the local community does not have that resource available, meaning there's only so many people available to do this work at this time, the local worker policy allows us to benefit other disadvantaged communities and say, yes, you will qualify as a local worker because you're coming from a zip code that is experiencing higher than typical disadvantages economically. Yeah. Mm-hmm. Yes.
The campus here, and we have many people that talk to us about an opportunity for jobs or being connected to the workforce. So I think that this is an opportunity to be able to bring it back and see if there's a way to help people in this way, or at least bring the message out of, hey, there might be an opportunity for this. So I would love to connect on that.
Would certainly connect with you before I leave today. And I also want to give a little bit of background too as to what we mean by local hire. It doesn't mean that we're necessarily hiring people for the first time. A lot of these trades, they're skilled trades. Folks start in the unions, trades, journeymen, they work themselves up. They start as apprentices, they work to journeymen. There's a path there. So what you're connecting with and why it's so important for us to partner together as well as the larger communities is to really give exposure to what's needed in this area to continue to develop at the pace we need to. Our trades, our contracting, labor, we are tight. Keep in mind that right now we have more projects coming to build. We have ambitions for the General Hospital, which will be big projects. The Olympics are coming. There's a lot of construction that could be happening in the next few years, and we're all pulling from the same labor sources. It is beneficial to us as those building partners to give exposure to high school students, college students, folks to say, these trades are available. It is an option for your livelihood. There is good livelihood and careers connected to these trades. And so pipeline is what we talk about. It's not like the project is here, we're hiring people today. We really need to forecast. If we're going to build in the next 5-10 years, that message has to start today so that that labor force is there and community members are understanding what opportunities they could have. So yes, absolutely, I'll step in with you. And thank you for bringing that up. Okay. All right. Thank you so much.
So yes, I think as Alicia was saying, the construction industry, you know, a lot of the folks in the construction trades right now have been in that field for a long time. We need that next generation to come forward. With the devastating fires in Altadena and Pacific Palisades, that rebuilding will be taking place over years and years, getting ready for the Olympics, and then the ongoing investments that the county is making here on this campus. It is a really good time to encourage people, you know, that like working with their hands, that maybe, you know, maybe an office job isn't the fit for them. That is very true for a lot of people. One of my cousins is a journeyman welder now. Like that was the path he chose for himself, and he loves his job. He loves his work. He loves building things with his hands. So I definitely encourage that we talk about these opportunities to folks. We have beautiful community college system. We're going to talk a little bit. I'll revisit later the health fair that's happening at LA Trade Tech College, but those colleges have really phenomenal programs to help people find their passion in different career paths. So, you know, just all of us that are out there talking to our communities and talking about opportunity, I think this field is one that will definitely have a lot of growth potential in the coming years. And with that, we're going to talk about some more development projects on our campus. I invite Alex Stamas from Century Housing to come up and talk with us about another program that's getting ready to break ground. Century Housing. Yeah.
Thanks, Heather, and thanks, everybody. It's certainly nice to be here again with you this morning. I'll try to bend down here so I'm closer to the microphone. If you could go to the next slide. What we're going to talk about today is one of the other phases in the Restorative Care Village. So this is Restorative Care Village Phase 3. One more, please. Restorative Care Village Phase 3 is the housing component of the supervisor's master plan that the county has been working on for so long on the Restorative Care Village. It is 2 phases of construction, Phase 1 and Phase 2. Both are about 150 units. The back building, which is Phase 1, and for orientation for a moment, the railroad tracks are behind Phase 1, and then it's Mission and Griffin here with Eastlake as our little street. Phase 1 is in the back. It is 146 units for families. It is 100% affordable housing, and half of that will be reserved for those who are experiencing homelessness, with an even smaller subset of that being for those who are experiencing homelessness and have a mental illness. The front building is 150 units. It's a senior building, very much with the same population dynamics. So half of affordable housing, half for those experiencing homelessness, with a subset for those with mental illness. The project includes 113 parking spaces, and also all of these really interesting health and community features. So Phase 1, for example, has what we call the Peer Respite Center. This is a 12-bed center where people who have formerly experienced homelessness are taught by those who have already gotten out of homelessness how they can effectively reintegrate into society. The goal is that we're taking people from the streets and helping them with a helping hand to get back onto their feet. That's in the Phase 1 building. In the Phase 2 building, we have a variety of commercial uses. That includes a pretty expansive workforce kitchen with an adjacent cafe and a retail space. The idea is that people from the buildings and the communities will be hired by this workforce center, trained with a set of skills, and can use those skills to on-site make food or other items that are then sold at the adjacent cafe and retail spaces. There is also a variety of improvements around the project, which I'll get more into. If you go to the next slide, please. All this is well and good, but it has to happen. I'm very grateful to say that we have been working hard that phase one will start construction in about 30 days, God willing. We are just ever so close. We've had a lot of help from the supervisor, which we've been very appreciative of, and are ready to start construction on this almost $100 million project. The project will take approximately 26 months to finish, and then the housing will be open right away. That's also inclusive of the peer respite center that's on site and the parking there. Phase two is a little bit behind. We had to tier the projects. Phase two just applied for its last round or its last piece of financing. We are hopeful to be successful. We got to figure it out. It's a very competitive process. We should know, however, in the next few months, if we are successful. And if that is the case, we would be starting construction on that project in January or February. So all these things are happening very fast. And that project can happen quicker because it doesn't have some of the same project features. So that's a 24-month construction schedule. The idea is that by 2027, early 2028, both of these buildings would be as you see them on the screen. Otherwise, you won't see me here because they'll have fired me because I didn't do my job. But we're really excited to bring these projects to fruition. It's been things that have been in the works for a long time. The restorative care village, as you all have heard, has been the result of tons and tons of hours and heart and work by the community and those involved to bring these projects to fruition. So we're very grateful to be part of it. If you go to the next slide, everything I just talked about, like I said, is great in theory, but we have to make sure it happens in real life. The way the county primarily does this is through an agreement called the Community Benefits Agreement. This is a legal document that my company, Century, or CADI, as you see on the screen, signs with HICP, this organization here. And that details in writing with legal signatures all of the things that we've just talked about to make sure that they come to fruition. And our community benefits agreement is centered along the 7 priority areas that the HICP has. You can see their nice little graphic here. If you go to the next slide. So these are the 7 areas. There's a lot of words here, but I'll go through it. So one of the focus areas is community stability. This is what we talked about before. This is 296 low-income, affordable apartment homes. These will be restricted as affordable housing for 75 years. In reality, it'll probably even be much longer than that. And like we've talked about on some of the community meetings we've had before, there will be a lot of local marketing for the lease up. Unfortunately, by law, we can't just say that only these people can live there, but we can do what we can such that the people in the community are the first to know how to apply, know when they can apply, have help applying, all these things, so that we can make it as much as possible a community populated by individuals from the local area. Opportunity. This is that workforce development kitchen. For those familiar with something like a Homeboy Industries, this is a similar idea, a social enterprise, where people from the building and the community are taken in, trained, and can sell the items that they make so that it continues to grow the program. And at a past HICP meeting, I think 2 ago, you would have heard from our proposed workforce development partner, LA Habitational House. We've been working with them for almost 20 years at a big campus we have in Long Beach, and they really do a fantastic job bringing people in, giving them skills, and just allowing them to live their lives. Economic development. Just like Alicia mentioned, we have the same goals, the same aspirational best effort goals to hire from the local area. That'll be 50% of the jobs for both projects. That's about $150 million of construction. The goal is that it's 50% done by people in the local area. And if we can't find them there, as close to the local area as we can do. You would have heard last week from our local workforce partner, Power to Workers, who presented last month, at the HICP, and will continue to present, such that we can do everything we can to bring in people to build these projects. That's also true to the best of our ability for the permanent jobs. We'll be hiring property managers, maintenance folks, people to work in the workforce areas, all of these things. And we're going to do the best we can to hire from the local community also. So you'll hear probably from the HICP when those jobs are posted and these kind of things. So to the extent you know people, we are all ears and open arms if they're eligible candidates. For transportation, we heard earlier in that great presentation about community safety and all these things. One thing that we've done in conjunction with what we've heard from the community is try to improve the pedestrian, bicyclist, and motorist safety around the site. So, you know, if you've walked that area recently, you'll know that some very nice trees have done some unfortunate things to the sidewalks, such that they're not very pleasant to walk on. We'll be tearing out all of the sidewalks adjacent to the project. It'll all be brand new. East Lake will be widened, have crosswalks, and especially for the benefit of the senior building, have a raised drop-off area. So people don't have to hop up on a curb to get into their building. In addition to street trees and a lot of other improvements around that project. The idea is that that area is pretty unsafe to walk around right now. And for us improving it, it'll be safer both for the people who live there and everyone else in the community walking near there. The idea is that people are flowing from the medical center to the buildings and back, right? The restorative care village becomes part of the community. We're hopeful that those pedestrian improvements will help facilitate that. And also, you may have heard before about this Valley Boulevard multimodal transportation improvement project. A very long name that means they're improving a lot of the streets, right? We're also helping the city give some money so that that process can move more quickly. Environmental justice. There's an environmental certification called LEED. Basically, if you see a LEED stamp on a building, it means it's very environmentally friendly. There are a few tiers, silver, gold, and platinum. We'll be gold, which is a pretty hard tier to reach, actually, on an affordable housing project, but we're grateful to do it. And also, the project will have 20,000 square feet of landscaped open space, plants, trees, shade, all the lovely things that we all want in the places we live and spend time. Health and wellness, we talked before about the Peer Respite Center. And for those worried that perhaps the people in the buildings will have challenges that aren't being met, thankfully we'll have tons and tons of people there, caseworkers dedicated to helping those people live the lives that they want to lead. And finally, safety, as I mentioned, the ASIC funds, or AHSC, this stands for Affordable Housing Sustainable Communities. This is a state of California funding source that gave us money both for the building and for all of these fun transportation improvements. And as I mentioned, will help improve the safety of pedestrians and motorists in the area. And moreover, we have also, hearing from the community that security is a concern, developed quite the security apparatus for the building. So we'll have almost 60 cameras in and around the building, monitoring things and making sure that people are acting as they should. In addition to, as needed, broader coordination with the security of the restorative care village and the hospital. So this is what we're hoping. This will come to fruition, and thankfully we're very, very close. So we appreciate all the work that's been done to get us here, and we're happy to bring this to fruition. Happy to take any questions, should there be any.
Hello, can you hear me?
Yeah, we can hear you.
Okay, so I do have a question, and I know safety is a concern, and I know there's going to be cameras and stuff. I just want to make sure that, and this is Monica Alcaraz, but I just want to make sure that it's not so much of a policing kind of thing because um, we deal with a lot of justice involved people. And I think that when we talk about safety, there's also, you are talking about the support that people are going to need, but I want it more to be more of a restorative justice type of thing than just like policing.
Yeah, I think it's a good point. Our goal is to minimize the instances where we need to call LAPD or LA County Sheriff generally. So the way that we're doing that on this project is we have cameras that have speakers attached to them. The idea is that if someone's coming onto the site and perhaps being threatening or these kind of things, that someone who monitors the cameras 24/7, every single day of the year, can speak into their microphone and say, "Gentleman in the blue jacket, please leave the site." We have that on several of our other buildings, and it's very effective. And so we're hopeful that that will reduce the incidents where we have to call the police to show up and take that person off forcefully. The other idea that we've tried to implement is designing the buildings and the physical spaces so that there's eyes on the street. The idea is that with people looking, for example, down their windows and this kind of thing, there'll be less dark corners and less physical places where unfortunate things can happen. again, to reduce the incidents where we ever have to call the police.
And just one more thing, to that effect, as far as calling the police, because I know that for sure will be necessary, right? It's necessary at different spaces, but I think it's also important to educate and make sure whoever's monitoring the cameras understand when somebody's having an episode, so that when we do call the police, we understand that maybe the person needs mental health services, right? And
Sure.
should be treated in that form. Because if you call the police and say, um, there's this guy yelling or this guy's like threatening, but and if they'll be treated a certain way. However, if you let them know, like, hey, it seems like this person has is having a mental health issue, you might need to get the pet team out here and, just have the right verbiage to the police. That's going to be really important, right? Because we want to make sure, yeah.
Yeah, thank you, Monica. That's a good point. I think we have a question here in the room.
Buenos días, mi nombre es Alejandro Castro.
Good morning, my name is Alejandro Castro, and I just wanted to say that, amongst a lot of bad things happening to us, this is really good news.
And I just wanted to let you know that with all these bad news, what you're presenting is great news.
Y eso nos da
And
una
that
luz
gives
muy grande
us
para un buen
a
horizonte,
bright
un lugar
light to
mejor
a
donde
great
vamos en el
horizon,
futuro
where place where
a
in the
salir de este hoyo
future
de
we
malas
will be
noticias
able to get out
y
of this bad
ojalá que la
news
comunidad se
hole, right?
pudiera,
And hopefully the
pudiera tener
community
acceso
can
a
have
un link
access
para las
to a link
viviendas
for
accesibles
the
y asequibles
affordable
para
housing
tener una
unit,
respuesta.
so we can have an answer to
And
that.
this is a light
And
at the end of the tunnel. We are excited about what's ahead of us and the horizon. And if the community can have a link, so that way we can find the affordable housing, that would be a great resource.
Yeah. First of all, thank you. It's really rewarding for me to hear things like that. So I really appreciate it. Also, we absolutely will be providing the link. It's just that we're too early. If I gave you the link and it doesn't happen for 2 years, everyone would lose the link. So you will see us back here at HICP coming to tell you at regular intervals, and especially once we're nearer to lease up, exactly how people can apply. And we will have our own staff ready and available at events so that people can come in and apply right on the spot with every amount of help they need. Sure.
Housing, not including any voucher project?
So it is a voucher project. So we have project-based Section 8, different than tenant-based Section 8. But those who are eligible for the units, meaning they are, for example, families or seniors and meet the income criteria, would be able to move into the units, and the unit would already have a voucher with it.
What about the voucher choice housing? Voucher choice housing that you can go anywhere in a.
Yeah, so this is a different type of housing than. Yeah, so the question was, what about people who have a housing choice voucher, like a portable one?
Yes.
So a housing choice voucher tenant would not live in this building.
Oh, I see.
Because these units already come with vouchers. It'd be an inefficient use of funds to have 2 units with a voucher or 2 vouchers on the same unit.
Oh.
So these are for people likely who don't have vouchers already, but would still apply for or still be eligible for the units.
Okay. So that means that voucher, you have to stay in that unit, permanent support with housing unit. You can not move anywhere.
Correct. So different than a housing choice voucher.
Right.
The vouchers we have on this project stay with the unit no matter who's in it.
I see.
Rather than a housing choice voucher, you move with your unit, right?
Okay.
This project, the vouchers stay.
Oh, thank you.
Sure. Oh, there's also a.
There's some. Oh, if you want. Yeah, first.
Buenos días. Yo
Good
vivo aquí en la
morning.
comunidad y
I
tengo una
live here in
pregunta.
the community,
Si
and I have a
puede
question.
servir estos edificios como
These
refugio en
buildings
caso
will
de un
be
ataque
good if
terrorista, en
as
caso de
a
un
place,
temblor
as
o
a
de algún
shelter in
desastre
case
natural.
of a natural disaster or a terrorist
Hi, good
attack
morning. I
or
live in the community. I have a question. Can these buildings serve as a shelter in case of a terrorist attack or an earthquake?
That's a really interesting question, actually. We have thought about this. It's not a formal use of the building, no, but you know, the way that phase two is designed, the phase two building, there is an overhang, right? That in the event of inclement weather like rain or this kind of thing, folks could be under the overhang and have some protection. But I think it's less likely. I think the short answer is probably no, but we are designing the building so it's as environmentally resistant as possible. We're doing things like having redundant energy systems. So if there was a outage of some variety, that folks wouldn't be totally without power, at least for a short amount of time. Sure, thank you.
Which is talking about the capacity of the units. Would these be units for individuals or could they accommodate families?
Oh, great question. So short answer is both. Most of the units are studios. Per county definitions, 1 or 2 people can live in a studio unit, but there's also several 1-bedrooms and a small amount of 2-bedroom units. So the short answer is to the extent you are an eligible household, meaning you meet the income criteria, you can live in whichever unit you have enough people to support. Any other questions? Oh, go ahead.
Digamos que estos apartamentos van a ser exclusivamente, digamos, como para personas que necesitan el rehab o que están fuera de sustancias.
Let's say these apartments, are they only or exclusively going to be for people on rehab or stop using substances?
No, not at all. These are for all kinds of people with all kinds of needs. So you could just be for example, a senior citizen who needs affordable housing. You can absolutely live here. But let's say you are also a senior citizen who has experienced homelessness and has a lot of needs. You can also live here. And we'll have services for everywhere in between.
Es como si fuera housing y LADC, I think. Creo que es la ciudad y housing.
Is it like housing or the city and housing?
So it is housing, and it will be, the rent payments are largely county funded. There is still a percentage of the rent that the tenant pays, but it is privately owned, but it is still affordable housing for the community. Does that answer your question?
Yes. Thank you.
Thank you.
Hi, thank you, Alex, for the presentation. I just wanted to emphasize that in regards to the housing and, the lease up, there's going to be, apart from Century Housing, they're going to work with a lot of community partners that we all know here. And they're going to be an extension to be able to help and guide interested tenants in regards to applying for the units. So it's not just going to be, Century. They're going to be working with a HICP here and many community partners. So we will look forward to, when the time comes, that you will all be connected. And again, working with our community partners, help those that are interested to be part of, the application pool. The more of the locals that are aware of what it requires, the documentation. There's going to be workshops ahead of time, so that the folks will be able to be walked through on the requirements and how to apply. And again, with translation. So we look forward to that when that time comes. But we're very excited that, the first building is going to be soon constructing. And we're also looking forward to all the job opportunities that people will be able to, partake in. So again, we're going to be continuing to work closely. Century Housing will continue to report out on, the progress, And we'll continue to have feedback. So we're very excited about this. And again, thank you for all the support.
Yeah, thank you very much.
Thank you so much, Alex. We're very excited again about all these incredible projects that are coming to fruition here on our beautiful Los Angeles General Medical Center campus. And to continue in that same vein, we're very excited to bring forward our partners from Centennial to speak about the upcoming, where we are in the project of the Centennial redevelopment of the Historic General Hospital and some of the parcels on West Campus, and a request for you all to support some of these efforts. Next slide, please.
Thank you very much, Heather. Good morning, everybody. My name is Leandro Tyberg with Prime Store Development. It's really a pleasure to be here again with you today in partnership and in community. I wanted to give you a little bit of an update on where we stand with the project, our community outreach efforts, and as Heather said, a request for support. Next slide, please. I wanted to first talk a little bit about the last community outreach meeting that we had, which was May 7th at the Lincoln Heights Senior Center, and had a very, very good turnout. Over 45 people attended, and even though so many people attended, it actually felt very intimate, and it was a great opportunity to really dialogue, communicate, and let people ask questions, really get into more of the details of the project. Even with that said, and as positive as it was, we are feeling that the community is looking for more interactivity. And as a result of that, we're going to be scheduling 2 workshops to really get into the details of how the community can assist, the process and education of the development itself, and getting into polling the community on more information on what the community wants to see with the process itself. And so those will be happening over the next couple months, and we're looking forward to coming back to you with information related to those dates. Some of the subjects, though, that did come up during that meeting are worthy of articulating now, and further questions have come to light that we really wanted to clarify. One of the questions that was posed was related to this forthcoming stabilization phase and whether we are going to be charging rent to the relocated wellness center. And the answer is no. The wellness center continues to be our key and critical partner on this endeavor and will be in what we call a gratis lease structure. Very much looking forward to assisting them through that new process, the new tenant improvements, and continuing to be in locked arm with them during that process. As a part of the stabilization phase, which we are going to be talking more about, we are continuing to work on our lease structure with the county. As a reminder, we will never be the owners of the property. This will always remain a community asset. We are looking forward to being partners with the county and the community as a leaseholder only. And lastly, as a part of the next stabilization phase, there are many buildings that are being designated, structures, I don't want to say buildings, structures that are being designated for demolition. Many of these are obsolete, falling apart, or dilapidated, but we are committed to not only mapping out, showing where these structures are, but making sure that there is no demolition of any structure that occurs upon anything that is of a historical asset or is not demolished prior to there being a usable restructuring. So, for example, if we are to take a smaller area or a larger area related to parking, nothing will be harmed until we have a replacement surface for those.
The structures you're referring to, it sounds mysterious, the 18 structures.
Sure. Let me give that to
We can
Giovanna.
definitely get to that here in a moment. Good morning, everyone. Yes, it is coming. Next slide, please. Next slide. One more. Thank you. So the stabilization project that Leandro is speaking to, we've given a series of presentations. We're happy to continue sharing more detailed information about every single scope and every single initiative that's being proposed as part of the stabilization project. We do have a bit of a summary here today, just so we can share with community and ask for your guys' support for this upcoming board hearing that's going to be so decisive in making sure that the stabilization project proceeds. So the stabilization project board hearing will be on June 17th. We're seeking authorization for the allocation of $100 million plus for a series of scopes that are the most critical scopes that really need to happen immediately on the campus and on General Hospital to stabilize and modernize these various infrastructure needs of the campus, and really get it to a place where it is safe and more usable and more user-friendly for the community. Additionally, in July, we'll be coming back to the Board of Supervisors to pursue authorization to proceed into the master planning phase of our exclusive negotiation agreement with LA County. So I'll explain to you guys what both of these things mean, what's included in each, so we can get a better understanding and really see how they build upon one another, but they're also just very independent and very needed for different reasons. Next slide. Guadalupe, would you like to say a few words about the board motion, or should I just proceed? Yeah? Okay, great. So the stabilization project includes a series of scopes that are going to work to do some seismic improvements to General Hospital. And as part of that seismic improvement, there's also a series of cleanouts that need to occur in General Hospital to prepare it for the seismic improvement. So selective demolitions of anything in the hospital that is non-structural and non-historic. So of course, preserving all of the historically character-defining features of the hospital is critical and paramount, and none of that will be affected. But if we're turning a hospital into a residential tower, we do need to remove interior walls and interior flooring so that we can rebuild new walls in the shape of apartments, right? So that's what that stabilization project would entail, is really kind of starting to work through these selective demolitions and doing an initial pass at a seismic improvement, which would improve the earthquake resilience of the building. So in case of a seismic event, the building will be better prepared and resistant so that it's now stabilized, it's safer for all of the users of the campus, and there's less of a chance that there would be any unfortunate loss of anything really critical about the building, especially the historic structure. So that's the stabilization project portion related to General Hospital. We're also proposing the phased demolition of structures throughout West Campus that are obsolete or not in great structural condition. I will talk a little bit about that here in a second. There will be a very concerted effort with all of our partners on campus to make sure that any structures that, although obsolete and not optimal for their use, are being used, that there is a continuity of operations plan so that their uses are not compromised. So for example, trash disposal locations, while that they may not be very ideal and some of that operation might be happening in structures that are now outdated and need an upgrade, nothing would happen to the trash disposal locations until there is a replacement system, so that there's a continuity of operations there and nothing is impacted about the functionality of the campus. So that's the kind of structured process that we're going through related to that. And then finally, the modernization of efficient heating and cooling equipment throughout the campus, and also some ADA upgrades. There's a lot of very challenging topography on the campus that makes it very hard for accessibility. And so as part of the stabilization project, rethinking that those circulation paths and rebuilding some structure so that there's better accessibility and it's safer is really important. So altogether, these scopes really bring the campus to a much better place, independently of anything else that we get to do somewhere in the future for the master plan, as that effort will continue also simultaneously. But these are critical. They need to happen now so that we're protecting and preserving what we have into the future. Next slide, please. So this is a map of, the campus from above. This is the boundary that we've identified for our California Environmental Quality Act purposes for the stabilization project. So this is also mapping here, the little circles with the numbers that you see. These are the structures that are proposed for the West Campus selective demolition. So they include a variety of trailers that are on throughout the campus. They're really kind of makeshift, and they've served a really critical purpose in making sure that there were sometimes additional office spaces for county administrative uses and things of the sort. But they're not ideal. There was a need, a trailer was constructed, the need was met, but now as we think through a better, more efficient campus, something more aligned and more fitting should be constructed instead. So in order to make sure that there is already like an immediate improvement to that, we're proposing that some of these structures be removed and demolished. And that also includes the West Central plant. The power plant is outdated. There are a lot of leaks going on with the utility piping systems for the plant. And so we're proposing that instead of having the plant, especially since General Hospital would be disconnected from the plant and no longer occupied, we can disconnect the plant and have some more modern localized systems only for the buildings on the campus that remain connected to it, as opposed to one central power plant overproducing energy, losing some services along the routes because of leaky systems, and that just being, just not very efficient. So that's another example of a structure that once there's replacements identified would get demolished. So those are some of the things that are going on in that really kind of summarizes it. Anything to Leandro's point related to parking or other critical uses, again, really important to emphasize. None of that gets demolished until there is a replacement in place and there is another way that those services will be fully met. So it won't all happen at once. This will be incremental and very strategic and really well thought out with all of our county partners and our campus partners. Next slide, please. Oh, and I guess also I would like to talk a little bit about the master plan on that too. So the July authorization for the master plan allows us to move from phase 1 of our exclusive negotiation agreement with the county, which was our due diligence project definition phase, where we did all these studies and figured out the plans for what to do next, into the phase 2, which is our master planning phase. So there's a series of efforts that happen in this phase 2. We'll be working very closely with community to start to think through how do we redesign the campus, what are the ideas, how do we start to introduce these really critical community programmatic needs, and really having the choices of how we're going to lay out the future campus on the site. As part of that too, that documentation is really necessary for us to create what's called a subsequent environmental impact report. So it analyzes, based on this new design, what are some potential environmental impacts that that can have. And that is a requirement by the California Environmental Quality Act that we do that. So it's really making sure, that there's as little impact to the quality of our well-being from air quality to other things related to the environment. There will be a notice of preparation that will be issued in the next couple of months saying that we're going to be working on this subsequent environmental impact report. And then sometime in December, we'll be issuing a series of alternatives to the project design, which are based on the different alternatives that the master plan phase design comes up with. and it allows the CEQA process to look at the options and choose the one that has the least environmental impact, and a series of trade-offs of choices there. And then that is a process of review that takes some months. So in that process of review, we'll be making some updates to those designs, and sometime in next summer will be a finalized subsequent EIR that then goes forward for formal approval so that we can get a project agreement going, which means, that sometime by the end of next year, knock on wood, this is a very, very ambitious timeline, but that really speaks to that momentum and making things happen. We would be ready to head off to implementation of the master plan. So that is what we're seeking authorization to kick off in July. And we're going to talk a little bit about now how you can support us in vocalizing, that this is critical, both tracks, that we need to do the stabilization project and stabilize the structures that we have now, and that we also need to continue to proceed with a master plan for the future of the campus.
It's very clear that Chair Pro Tem and Supervisor of the First District, Hilda Solis, has been a champion of this effort for a very long period of time. And we know that we can count on her support for the upcoming hearings. But it's also very important that we show the other supervisors just how important this campus is, not just to this community, but to the entire county of Los Angeles. The vision and this dream of this project is to create a regional hub of not just health, wellness, job economics, entrepreneurship, housing, but to really show this as a beacon of what can be done with a community redevelopment voice that could be amplified across America. We really want the other supervisors to know just how important this is, which is why we need your support. We would love for you to come lend your voice during these hearings. If you can't make it, you can write an email, you can write a letter, you can call in, and we have all of these opportunities and tools that we can assist you with on how best to connect during those events. Your voice is absolutely critical to this next process. And we know that this is not the easiest thing to understand. We talk about stabilization, we talk about retrofit, we talk about master planning. We know this is complicated. We are here for you to dialogue and talk about confusing questions, opportunities for further education. We will come to you to discuss this further. Please come see us both after this event or at our website or at our office here at General Hospital so we can really hold hands during this process. We want the community to be empowered to understand what is happening and make sure that they feel like they are included and a key partner during this process itself. Next slide, please.
Okay, so a little bit of information here on the options and how you can support. We're sharing here, if you would like to call into the hearing and voice your support, this is the phone number. You would just dial in the code to participate, and you have an opportunity to speak for a few minutes on why you think it's really critical for this project to advance. So again, this will be on June 17th. And that happens throughout the day on June 17th. So we can share a little bit more of information too, as far as timing for the phone calls once there is an agenda that's made public. But also if you're able to look through the website for the hearing, which we're going to share here as well, there'll be consistent updates on times for call-in. So this is one of the options. Next slide, please. The other option is a letter of support. If you're interested in submitting a letter of support, you're welcome to write one on your own independently and either email it in or mail it in. We're sharing here the information on how to do so. In that correspondence, you would include information related to the meeting day and the project that you're vocalizing your support for. If you'd like some support with the letter of support, we do have a template that we can share. So please come talk to us, and we'll get your information and we'll share a template with you so that you have already something to start from. And we're also more than happy to, once you have your letter complete, collect that letter from you if it's easier, and we'll submit it on your behalf. We'll be doing a batch submission of a series of letters of support that we're receiving. And so we can include yours in that batch as well. Next slide, please. And then, of course, in person, the hearing will be held at Kenneth Hall of Administration. So you're welcome to attend in person. There will be a kiosk where you can also, in addition to attending on the day of, sign up to be offering your support and actually speaking at the hearing. So that is it. Oh, yes, we'll provide transportation as well. So if anyone here is interested in attending in person and would like transportation, also please come talk to us. Thank you.
Great. Thank you so much, Leandro and Giovanna. I think we may have a follow-on commentary from SD1. Is that right? Okay. And then we'll take your questions after that. But we're going to let Guadalupe Duran Medina from Supervisor Solis's office come to the microphone.
Hello again. This is Guadalupe. Thank you, Centennial Partners, for the presentation. And I know the community has been, on the side, working with us to move this very important project. As everyone has said, this is a critical project for the supervisor, but also for the community. We want to preserve the general hospital. We want to turn it into back to the community for community use. And we also know that there's a lot of needs, right? So this project is very critical to us. And, we have heard from the community as well that what can we do to ensure that this project, keeps moving and it is delivered. And we know the supervisor's term will be ending next year. So we are doing what we can to make sure that this project moves forward. And there's critical, timetables that we have to meet to deliver certain things. We have the stabilization project, obviously, that is, starting hopefully, soon. And then separate from that, the master plan, which is the project that will be the reuse right after. And they're both separate projects. And, that discussion on the master plan, we will be diving into more, what are the uses, right? How much affordable housing? We know that continues to be a constant interest. And as you've heard, and I'll repeat again, the supervisor is very committed to ensure that we maximize the amount of affordable housing as part of the master plan. And we will get into those discussions. And, there's going to be a series of meetings. There's going to be a lot of more engagement around that. So we're looking forward to that as well. And but your participation is critical at all these stages, and we're hoping to continue to see you there, and to spread the word so that more people can be involved. That is very important. And again, working with Rosa here, the Wellness Foundation, HICP here, we are going to need your support for these hearings, that are coming up June 17th on the stabilization project. And then on July, there's going to be another action that will help us move forward on the master plan. We're going to allocate some funding there for that, again, for environmental, for design. Engagement will be part of that again. So we're really looking forward to all of your support. We really need to show the county, as Leandro was saying, how important this site is. And the community has worked on this site for so many years that it would be a shame to not deliver a project, right, after all this engagement. And so but we are also very cognizant that we want to maximize the community benefits that the master plan delivers, and we're very committed to that. So, but we also want to make sure it's a viable project. So there's a lot of balancing that has to occur, and but looking forward to that. Rosa, do you want to say?
Good morning, everyone. Well, it has been an exciting meeting, a lot of good progress in the work that we are doing to ensure that all of what community needs, all of what our county partners have been facilitating is coming to fruition. So thank you so very much. And related to this project, we're excited that we've gotten here to the point of really looking at the stabilization of our general hospital. For those of us who live in the building every day, we can tell you it is very much needed for us to ensure that the building is ready for its next phase. And I have asked the question, is it safe today? And it is safe. That's why we continue to be in the building. But that being said, there's work that needs to be done to preserve this beautiful structure. So we're excited about that. We've been asked through HICP to contact our membership and partners. So we'll be contacting you and asking to support either through a letter of support, through coming in person, through calling in. And so we will be working with our partners to lay that groundwork and ensure that we have a response from our partners before the Board of Supervisors on the 17th. There's also a need, I think, to ensure that there's an understanding of how important the landmark is, not just for our East Side communities, right, but for our region. And the importance of this being a campus that serves not just Supervisorial District 1 or the East Side, but that it serves the entire county. So we're super excited to reach out to other partners that might be able to complement their support, the support of this community, right, in this effort. So, so we'll be reaching out. If you know a partner that you think would be good for us to talk to, we're happy to go and speak to them as well. And then, so the in-person, the letter of support, and then a call-in. So we're going to try to track on, what is needed from the partners to get you all of the information that you need in order to move forward in having our presence seen at the Board of Supervisors on the 17th. With that, I don't know if there's any questions on the chat that we need to address. There is a comment by Jasmine Perez about concern for the approval of more public funds on a project. Her statement, and I don't know, Jasmine, if you want to just share your statement, but that the developer is not willing to commit to providing 100%. Providing the community needs with 100% deeply affordable housing. Again, I think we've heard from, both Centennial and Supervisor's Office. There's a lot of desire for us to maximize the project, but we're going in phases. So I'm very confident that we're going to have those discussions in the next phase. Today's conversation about the stabilization of the building and the West Campus properties, but yeah, so that's what we wanted to share. So you'll be hearing from us, and we're excited about, again, this next opportunity to get ourselves ready for what the future of our building and our campus can be and how it responds to community benefit. And I loved, seeing Century's list of not only what the priorities are of the community, but how we're addressing them specifically. I think the transparency of that, just creates so much, I think, confidence to what HICP has been trying and striving to do since 2017. So thank you, everyone who's been part of those meetings, those conversations, right, and all of your time, because it's sometimes late evenings and weekends, and we've appreciated the process throughout. Yeah. So we have a comment. Can we get a comment over to Diego?
Thank you, Diego Rodriguez from Alma Family Services, and so excited for the project, excited to lend our support on the 17th as well. And we know that many HICP partners will be there in support, and many might be providing letters of support as well. But for those of us that are familiar with this process and have testified before and lifted community priorities in that space. We also know the power of collective support, right? There's strength in numbers. And as a coalition, I mean, we've been aligned with and we've been supportive of this project for, since its inception. Therefore, I think it would be important for us to take a stand as a coalition, as a consortium, and perhaps it's a good idea for us to submit a letter of support as HICP, right? And I think it'd be great to have an opportunity to lend our logos, to lend our signatures, to lend our voices collectively to show unity as a group in support of this project. So I hope I'm not out of line, but I believe that as a member of the consortium, we can make motions, right, for actions. Therefore, I would like to make a motion for us to have a joint letter of support as HICP, as a collective for this project for the 17th.
Thank you, Diego. We appreciate that. Any comments related to the motion? So the motion that Diego Rodriguez is recommending is that we do also a collective letter. So your organizations can individually send a letter, but we would send a letter as a health innovation community partnership with logos to represent the collective body, right? That meets every month and is part of this process with our developers and partners of the county.
Hola, de nuevo, buenos días.
Hello, everyone. Good morning. My name is Alejandra Castro. I believe this is the moment to support our supervisor, Hilda Solis, because she has kept our community united, strengthened in the most difficult moments. And I think this is the time.
My name is Alejandro Castro, and I think this is a moment to support our supervisor. She's fortified our community, and she's always backed us up whenever we've needed it.
Si yo me pongo a mencionar los beneficios que hemos
If I
recibido
mention the benefits that we've had throughout this great vision that our supervisor Hilda Solis has been many, and many communities have benefited from this. And we have received a lot of benefits from the LA General Hospital and the historical.
We've received from her, there's many. And as a community, we've also benefited from the General Hospital and also the historic building.
Estoy hablando de toda la comunidad
I'm
alrededor.
speaking from our community and our surroundings and all the county and other people from other states. And I just want to finish by saying that I wanna, embrace our community for community outreach and to ask for the support. This is the time to respond to our supervisor. She has kept us united and strong during the most difficult moments.
That the community I meant is from different states and from the whole county. And I think it's time to embrace our community partners and also support our supervisor, which has kept us strong during these difficult times.
Perdón, para finalizar, este es un gran proyecto.
And just to finish, this is a great project, and I think we should support.
I want to support it, so thank you.
Muchas gracias, don Alejandro.
Okay. Buenos días. Mi nombre es María Ponce de León.
Good morning. My name is María Ponce de León.
My name is María Alfonso de León. Ponce de León, sorry.
Soy miembro de la comunidad.
I am a member of the community of Boyle Heights for 30 years. I have participated in the community meetings.
I've been a member of the Boyle Heights community for over 30 years, and I've participated in the community meetings.
Además de trabajar en esta área de Boyle Heights.
And I've also worked in this community of Boyle Heights and Lincoln Heights and Clínica Romero.
Besides working in the Boyle Heights, Lincoln Heights area and Clínica Romero.
Y ser parte del programa de CPSC.
And be a part of the HIPC program.
Part of the program of CPSD.
Estoy muy orgullosa de
I am very happy and proud to participate in these events.
I'm very proud of participating in these events.
y también dar mi apoyo
and to provide my support because this program, then since the start,
Hospital General histórico
has
se continúe.
ensured that our historical LA General continues, and it's important as a member of the community to keep it standing and for this project to continue.
Again, it's also important for me to show that I support this project and that as a member of the community, that the historic building continues.
Y el 17 de junio no
And
solamente
June
voy a ir, yo
17th,
creo
I'm
que
not only gonna be
hay que
there,
pasar la
I
voz
think we need to, spread the
promotora de
word
salud,
and, as
promover
the health
decir que
promotora or
apoyen
promoter, we need to
programa
let the
porque nos
community to
ayuda no
support this
solamente
program because that
a
helps
nuestra
all of us,
comunidad, sino
not only the
también a las
community,
otras
but
comunidades
also
como
other
Lincoln.
communities like Lincoln Heights.
And on the 17th, not only will I be there, but I'm also going to spread the message for other communities to be there because it also benefits like Lincoln Heights.
Así que cuenten con ese apoyo de parte mía. Gracias.
So please
So you
count
can
on
count
my
on
support.
Thank you.
Thank you.
Muchas gracias. Hi, Vivian. Good morning. Thank you.
Good morning, everyone.
Yeah, you're fine. You're fine.
Hello, are we good?
Yeah.
Oh, thank you. Good morning, Vivian Escalante, born and raised in Boyle Heights, CEO, Boyle Heights Community Partners. And I see the motion is on the floor. Great to have a second on that. I will definitely have a letter of support and would love to participate with the collaboration as well. And again, we've come so far, and we are very excited about this project, which is long overdue for our community. And hope that also we can have additional public housing in the future for everyone so that we can utilize this space. So thank you very much. It's a great pleasure to be here today.
Thank you, Vivian. All right, online we have a comment. Let's look. So Monica Alcaraz, you agree that we as HICP should send the collective letter? So we haven't done these in a while, but I feel like when we have a motion and a second, we sort of ask for any opposition, and then if there is an opposition, then we carry forward with the motion. Does that work? Yes? Or do we take a vote? Do you remember? I can't remember.
Yeah, let's do kind of the moving green card vote and then do a formal vote of the actual numbers. So it would be everyone in the room would be the members.
Green card members or members that are official. Okay, how do we do that? How do I do that? Because we have folks on so if we have founding members on the call, then let us know via raised hand if you are in agreement with going forward with the motion. Motion is to send in an HICP collective letter in support of the stabilization project before the Board of Supervisors on June 17th.
I think now we'll ask for, so there's three votes. There's yes, there's more discussion, and opposed for the three options.
Okay.
Red, yellow, green, basically.
Okay.
So I think you're all green.
Yes.
Favor. So I think the question is now, does anyone
I'm going to talk in the mic so they hear you.
Yes. Hello, everyone. It's been a minute since we've done one of these votes. We have to refresh our memories, but thank you so much for going through this process with us. We're very excited to consider the opportunity for HICP to present our collective support letter for this investment to stabilize General Hospital so that additional work and additional ideas can come to fruition. So as we do in HICP, we have three types of votes that one can cast. One is I endorse the motion. One is I request further discussion. Or the third choice is I oppose the motion. So we have asked for those that endorse the motion to please raise your hands. For those that are the founding members of HICP, we have our online votes. We would like to ask for in-the-room votes as well now. Please raise your hand if you endorse the motion without further discussion. Okay, great. Thank you so much. Hands down, everyone. Also online, hands down, please. Okay, so now we'll ask if there's anyone that would like to have further discussion. Please raise your hand if you would like further discussion on the issue. Online, you may also raise your hand if you would like further discussion on the issue. Okay, we have one vote in the room, no votes online that I see. The final vote opportunity is for those that are opposed to the motion. If anyone is opposed to the motion in the room or in the Zoom, please raise your hands. All right, I don't see any additional concern. We have one vote for additional discussion. Did you want to raise a particular question? Maybe we can address that as we move forward.
I just want to talking about the permanent supportive housing project and also the voucher choice thing.
Mhm.
And I just want to see that it by the service area or the region thing type thing like that. I would like to further more discussion further more about that thing.
Absolutely. And I
Yes.
think, thank you so much for raising that. I think, as we know, Alex's project is dedicated as permanent supportive housing. The project we're talking about right now, Centennial, the opportunity for what will come next isn't fully committed at this time. The vote we're taking today is to endorse the investment to stabilize the building so we can decide down the road what type of housing goes in there, whether it's permanent supportive. I know, Vivian, you're a very strong advocate for housing for veterans. We know many people, if not everyone here, is a strong advocate for affordable housing. So all of those opportunities exist once the building is stabilized so we can consider what comes next. Does that make sense?
Yeah.
So that set of permanent supportive housing opportunities down the road quite a bit. Of course, Alex's project is the one that's coming online right now. So I encourage you perhaps to talk to Alex about specifically the Century project, and of course, continue coming back and being that strong advocate for permanent supportive housing, saying that we have more needs in this community for that type of housing. We have, Guadalupe from Supervisor's Office. We have our Centennial partners here. So be that strong voice. But right now, that's a little down the road for the Centennial project.
Yeah, and then I also want to talk about the service area, like right by the division. So I do not know, are you build that project in the Sun region or service area?
Yes. Yes, I didn't quite understand.
So is your question, how is the project going to serve our local area or the region?
Yeah, like a
So-
county-wide thing, the county-wide thing, will not be city-wide, but
So it is a county-wide project because it will
Right.
be approved by the Board of Supervisors. It is on this campus. It's that beautiful white building behind us, right? That we know is historic and almost 100 years old. And because of the importance of this campus, people come here to receive care, to receive services, right? They may not be living in the immediate area. So the idea is we are serving the immediate area, but there are ways in which our entire county benefits from a project as strong as this because of its regional impact and how well we know the project from the entire county lens.
okay. All right, thank
Yeah.
you.
Good. Thank you so much for your questions. And again, thank you everyone for all of your questions and for bringing these ideas forward. This is exactly the kind of conversation we want to encourage. With that, it looks like we have very overwhelming endorsement for the motion. So we accept the endorsement of the Health Innovation Community Partnership to write a collective letter in support of the board motion that will be presented on June 17th. So thank you all.
And let's thank Heather for remembering our process. Thank you, Heather. All right. Where are we on our We're wrapping it up. Okay. So again, just want to thank everyone for your commitment to our Health Innovation Community Partnership work. not only monthly, but in the individual work. We're really moved and excited that, again, Century can clearly articulate where the community benefits are. We actually looked at their CBA in great detail. I signed it on behalf of our HICP because it aligns with all of the things that have been agreed to here. But maybe what we can do also is have copies in the future so that we can share with folks, what is in the community benefit agreement. We are also excited about Centennial, coming to the table with the idea that the wellness center can continue, right, as in a not a gratis um, type of lease, which continues to for all the partners in the wellness center, right? It's been a question that we've had, right? What does it look like for us? And I know there's transitions, there's sort of a next step and then steps after that. So being part of this together as an entire community, I think allows for there to be a lot more working together and working forward than than there probably had been in the past with developments in our community. So we're really excited about, again, all of the progress, thanking each and every one of you, and looking forward to seeing some of you, hopefully many of you, on the 17th at the Board of Supervisors, and we'll be contacting you for letters and next steps. So thank you all very much. And with this, we conclude the meeting.
All right. So thank you so much. Just wanted to make our announcement that our next meeting normally falls on the first Friday. However, that is the 4th of July. So we'll be pushing to the following week, and it will be held on, I don't think the 14th is quite right. Is it the 12th? The 11th. Thank you. I'm like 4 + 7 is 11. So the next meeting will be on the 11th of July. I did want to take down the PowerPoint slides and invite our colleague from Native Made to make an announcement about the upcoming healthcare workforce event that is going to be hosted in the fall. Thank you so much for sharing the information in the chat, but I thought we'd give you an opportunity to actually make an announcement to our collective membership.
Yeah, thank you. Thank you, Heather. Can you hear me okay?
You sound great. Thank you.
Okay, terrific. Yeah, I'm representing Native American Made. We are very underrepresented in the medical professions, and we did an event at LATTC 3 years ago with the veterans, a health fair event that was good. Part of the reasons for LATTC is because they're very centrally located. They get metro access, good freeway access as well, although oftentimes that's pretty congested, but still it's pretty much in the center of the county. We're partnered with LARC, which is the umbrella over 19 community colleges throughout LA County. So we want to make this a county-wide event. Our other partner that we worked on this is LA City Workforce Development and their Workforce Investment Board Healthcare Sector Advisor, Dr. Kelly Wynn of Dr. Kumo Academy. And so the healthcare sector, as many may know, is a very big shortage of people, and we want to inspire some of the youth. And so this being at the beginning of the year, I think would be a great opportunity to actually give the students visibility of some of the clinics. We're also partnered with CCA LLC. It's a coalition of the 66 FQHC clinics throughout LA. And to have the visual presence, and hopefully I could talk to you too, Heather, right, for HICP. I think that makes this health sector more visible. I don't know if the students don't often see or feel it, so we want to really be impactful, and hopefully this could be the first of many years, but more of a county-wide effort to outreach to the students and get people on that career path. Appreciate that. Thank you.
Yeah, thank you so much for sharing. Yeah, we're very excited to welcome Native American Made into the Health Innovation Community Partnership space. I am sure that this campus would be delighted to be in partnership with you to encourage more of our Native American population to join us in the healthcare field. We're very proud of the county footprint that LA General has in serving all communities that reside in LA County. So thank you so much for joining us. We will stay tuned for more information. I understand that this health healthcare workforce fair would be happening in the fall. Is that correct?
We're hoping for September, maybe the
Okay.
third week of September, third, fourth week. It's in lieu of American Indian Day. It's in honor of that day. It's that month. And so we want to kind of coincide with that. This is for everybody. It's not just Native American, but we want to definitely be visible for some of the Native Americans. LA County is the largest population of urban Native Americans nationwide, and so that's part of giving them some connection to come out, right?
Wonderful,
And
yes.
see everybody.
Thank you so much. And then, that encouraged me to remember that we have been invited, the Wellness Center has been invited to participate in a in a health fair that's being held at Cal State Los Angeles on June 21st, 2025. That is part of the Sacred Path Indigenous Wellness Center. So it's a healthcare event and a health fair focused on Native American individuals, cultures, and traditions. And so everyone is invited to join that event on June 21st, 2025 at Cal State Los Angeles. So very exciting that we have these two opportunities coming forward in similar space. So thank you again so much for joining us, MacGyver, and we look forward to your continued participation.
Thank you.
All right, we will go ahead and send those announcements out and flyers for these special events to our HICP membership. But with that, we are indeed adjourned. Thank you all so much for joining us for the June meeting.